let's check your reflexes. Brachial radialis. Try to relax here, okay? Oh, did you see that? Okay, good. I'm going to do your biceps here. Good. Your triceps. You relax.
Oh.
Not relax. What are you gonna do this weekend?
That's a great question.
Study? Study.
Probably.
Okay.
I might do the focus assessment test. We'll see.
Okay, let me have you take your shoes and socks off for me, please. Thank you. Okay, so I'm gonna check her pedal pulse. Cap refill, which we can't really do, but tibial pulse. L plus 2. I'm going to check you for edema. Can I pull this up a little bit? Okay. A little trace of edema. All right, and then let's check your reflexes here. So I'm going to go ahead and check your patellar reflex. I should have made sure you could reflex before I let you be my patient.
You tested them last time.
I know, I remember now. Just relax here. Okay. Oh, we got that one. Okay, I got that one too. Okay. Yeah, nobody's gonna want to bring you in as their partner. Got him. Okay. So guess your patellar and your Achilles there. Okay, so let's go ahead. We're almost done. Stand up. You can put your shoes and socks if you want. If not, it's fine. Okay, so I'm gonna have you walk over the corner. And come back. Okay, good. And now I'm going to check you for scoliosis. I'm going to have you go ahead and lean over, touch your toes. Can I pull your shirt up?
Yeah.
Okay. Hips are equal. Come on, look at her spine here. Nice aligned. Shoulders are equal. Okay, very good. We're almost done. Actually, we are done. Did I forget anything?
To inspect your skin on your legs, which I do see you have pants on, so we'll just go with what we can see. Make sure you have no edema or anything odd. Is there anything like you have any varicose veins, any spider veins, any odd moles, anything that's no? Okay. Any pain? Okay. So I'm gonna make sure check for edema. What I can see, I'm not seeing anything. Everything looks good. Just gonna palpate around, make sure there's no pitting edema or anything that I can't see. Okay. And then I'm gonna do cap refill on your toes. So make sure you have good perfusion to your toes also. I'm not seeing any clubbing with your toenails. Everything looks good. A good cap refill, less than 3 seconds. And then I'm going to do your dorsalis pedis pulses. Make sure I can feel those. Okay, they're about a +1, which is normal. We don't usually feel them as much, so they are good. I think that is all. Do you have any concerns or any needs or anything before? Any questions? Okay, well, thank you.
Okay, so I'm gonna ask you because I'm gonna test for some lower extremity range of motion. So I'm gonna ask my patient to lay down flat. Okay, perfect. And while you're doing this, I'm going to see if you can bend your knee. Okay, that's good. Bring your leg out. Okay, lift your leg. Okay, okay, down, perfect. Let me see this knee, and I'm going to compare bilaterally. Okay, can you lift it up? Okay, okay, perfect. Do you feel any discomfort in your hips? No? Okay, let's put the arms on the side. Very good. And now with your feet, you're gonna do some flexion and extension, rotation. Okay. My patient has full range of motion also in the lower extremity. So while we're doing this, I'm also checking for the thumb test, and this is for the hips to see if there are any pain or discomfort with the hip. Of course, you cannot do this test on patients that have a knee, hip replacement because it will cause a dislocation. So I need you to bring your knee, put your arms like this, bring your knee, okay, towards your body. Do you feel any discomfort? No? Okay, so you can bring it down. Perfect. Okay, so also checking for the knees, I'm gonna do the development test now, and basically I'm stroking down my hand, and then I'm gonna put pressure here and up, pressure, and this is to check for the patellar. Okay, any discomfort?
No.
Okay, that is a development negative test. Okay, next I'm gonna do the McMurray. I'm gonna bring your knee like this, okay? And down, again, you basically wanna do this a couple of times. Any discomfort?
No.
Okay, just keep your arms here, thank you. Okay, so while checking for the knees, I'm going to do the anterior cruciate sign. So bring your leg like this, and I'm gonna say that your foot and your feet, okay? Okay. Lastly, I'm gonna ask my patient to lay on her stomach because I'm gonna do the athlete grind test, okay? Thank you. And we'll bring in your knee like this. Okay. And this is basically to check for rotation, any lateral, extreme lateral rotation. Okay. That's fine. Okay, so you can have a seat now. Okay, Miss Suarez.
Sit up for me. Alrighty. If you could roll up your sleeves, we're going to take a look at your arms. Looking at the color is evenly distributed. I'm just going to feel with the back of my hands down. It's warm all the way through and dry. Coming down to the fingernails, I'm going to just press on your fingernails here. Testing the cap refill. It's all under 3 seconds, all normal. If you could hold out your hands for me, I'm going to test your strength. So like this, push against my hands. Alrighty. Then take my fingers, squeeze them, and pull. Good. Maybe you could close your eyes. I'm just going to tap one of your hands, and you tell me which one I tap.
On my right.
Perfect. Alrighty. Coming down to the legs, if you could roll up your pant legs. I'll be doing the same thing. I'm going to look at the color. Color so far is normal. It's evenly distributed, no pale or flushing here. Feeling down the legs. It's warm, dry, intact. If I press here, there's no swelling, and I don't see any pitting that you would see with edema. Coming down to your pedal pulses. You can feel both pedal pulses, they're normal, they're even, and then cap refill time here on your toenails, your toes. You think it comes back. You could also do that if you were wearing nail polish, but you're not. Alright, sounds good. While I have you down here, I'm just going to take a look at the skin on your heels. Just looking for any breakdown of the skin. If there isn't, perfect. And then I would have you just stand up for me. Would you mind and then before I do that, I'm going to ask you to close your eyes I'm going to touch one of your feet. Tell me which foot I touch.
Left. Right.
Alrighty. And then I'm going to put my hand on your feet. Could you just pull up against my hands? Perfect. And then push down like a pedal. Perfect. Strength is even on both sides. Alright, awesome. Now would you mind standing up? I'm going to take a look at the skin on your back and your buttocks. And for any skin breakdown, these are places where they normally high risk for breakdown. Nothing on the back and nothing on the buttocks. Okay, and then before we finish up here, I'm just going to take a look at your radial pulse. Alrighty, and both of these are even, the same on both sides. And we would say all 4 of your pulses on your wrist here and on your feet were +2, normal. Alrighty, thank you so much, Mrs. Lori Blackfin. I'm going to perform my hand hygiene. The doctor will be with you shortly. Hopefully we can help with that chest pain, figure out the root of it, and get. Thank you.
All right, thank you.
Hand hygiene, and I leave.